everyone, welcome. We are here to present the CO21 Impact Study, which is aiming to leverage AI to support the delivery of a structured exercise program to people with colon cancer. As a part of this project, you get to work with a super cool multidisciplinary team, and we will just take the time to introduce ourselves now. So I'll hand it over to Kristen.
Hello, I'm Kristen Campbell. I'm a professor in the Department of Physical Therapy at UBC and was one of the co-investigators on the challenge trial that you're going to hear more about.
Hi, everyone. I'm Lorraine Capozzi. I'm a cancer physiatrist, a rehabilitation doctor, and provincial medical director of cancer rehabilitation with BC Cancer.
I'm John Jose Nunez, a cancer psychiatrist, and also run a lab here at UBC, applying AI to psychiatry and cancer care after doing some grad school in computer science. And I also had a great time working with Capstone students last year.
And hello, I'm Kelsey Bland. I'm a postdoctoral research fellow in the Department of Physical Therapy at UBC and also a clinical exercise physiologist, and I'll be working with you on this study. So let's give a little bit of background on why we're doing this project. Colon cancer remains a major global health challenge. It's the third most common cancer worldwide, and it's the second leading cause of cancer-related death. Despite standard treatment, outcomes can remain suboptimal for patients, and recurrence can occur in 20 to 40% of people who are diagnosed. The impact of colon cancer extends beyond survival, though. The treatments themselves, including chemotherapy and surgery, can reduce quality of life and physical function. So we need interventions that can improve both survival and patient quality of life. So last year, a landmark study was published called the CO21 Challenge Trial, and it was the first large randomized control trial to show that exercise can actually improve survival in people who had completed chemotherapy for colon cancer. And it created a buzz worldwide because this was really a pivotal study for our field. This trial itself, as I mentioned, was a large RCT, and it enrolled 889 patients from around the world, but mostly in Canada and Australia. The intervention itself included structured long-term exercise support that included individualized behavior change counseling from qualified exercise professionals. And this was delivered every 2 weeks for the first 6 months, mostly in person, and then monthly for 2 more years. And the goal of this intervention was to increase patients' aerobic exercise levels by 10 Met hours per week, which is 2.5 hours per week of exercise. So they had to increase their exercise and sustain it. The primary outcome for this project was disease-free survival. And compared to the health education group, which was the control group, there was a 28% lower risk of recurrent or new cancer, a 30% lower risk of death, and improved quality of life and physical fitness. And the survival benefit that we saw with this exercise program was actually on par with some chemotherapy agents that are prescribed. But we know there's an implementation gap when it comes to exercise and other supportive care. Currently, exercise is not offered as a part of standard cancer care, and high quality evidence doesn't necessarily equal access. The original challenge exercise intervention that I just discussed was designed for a clinical trial setting, not for implementation. It was very resource intensive, it has limited scalability across settings, and it doesn't have equitable access for many different people. So we need new delivery models that can support the delivery of this proven intervention. So we're proposing an LLM chatbot. We know that chatbots can interpret patient language and tailor communication for diverse users. They have user-friendly interfaces, and they might be able to increase exercise behavior change program accessibility. So we're interested in using an LLM chatbot to support clinicians to deliver this proven exercise program at a larger scale. The project includes adapting and refining an existing chatbot at BC Cancer. We want to firstly align the chatbot with the original intervention theory-driven behavior change strategies. 2, incorporate stakeholder chatbot preferences. So that includes patients and people with lived experience of colon cancer. And finally, optimize the tone, clarity, and personalization of this chatbot. I'm now going to hand it over to JJ to talk a little bit about what your role as the students on this project might be.
So the challenge trial involves these different modules to help cancer patients start exercising. Your job is going to be to first choose a couple of those modules and to work on the chatbot to help patients through that. It's going to require a retrieval augmented generation or RAG system. And you're going to first build a system, using some prompt engineering, trying out different models, testing different retrieval techniques. And then we're going to test it really quick, get that feedback back to you, working with patient partners and clinicians. And then you're going to get to iterate. Patients are probably going to bring up lots of different things. So you're going to get to have lots of fun and make that system really helpful and really exhaustive. And then, do you mind next slide? From this experience, I think you're going to get a really exciting and really useful experience building an actual real-world implementable tool to help patients with cancer. You're going to get to work with a multidisciplinary team, which is always great because that's what for AI to really be impactful, it's going to require a lot of different people. We're likely going to be able to do some co-authoring of abstracts and publications. And there's also the potential for future employment. We were actually able to hire 2 MDS students last year as part of my lab. And while this is always going to depend on things like funding, we'll be hoping to also have opportunities in the future as well. And then last but not least, we're really hoping that this is going to be something that has an impact and helps patients with cancer.
Awesome. Thank you for watching.